that we've heard about the case of Amos Soka, who unfortunately passed away because of Ludwig's angina. Should you fear going to the dentist? Most of the time, when you get a toothache, it means that your tooth has already been infected by bacteria and it needs to be attended to by a professional. So when you have a toothache and it's left unattended to, that infection can spread past the tooth into the jawbone and into the potential spaces that are around your chin. We call them potential spaces because they are very tight spaces that are bound by muscle. So when infection gets to these areas, it causes the swelling to be very firm. We actually refer to it as a woody swelling, meaning it's very hard swelling around your neck area and around your chin area. The swelling doesn't just grow outwards, it also grows inward. What that means is that it happens on the floor of the mouth, and as a result, it pushes your tongue upwards and backwards. When that happens, your tongue now obstructs your airway, meaning one, you're going to have difficulty breathing. It also means there will be difficulty swallowing either your saliva or food, and that can result in drooling. And third, because of that swelling of the tongue, it affects your speech. And we usually call it like a hot potato voice. Then it also affects your breathing, as I mentioned. So you get breathing that is very shrill or high-pitched breathing, which is stridor. And at this point now, it becomes a medical emergency, mainly because your airway is obstructed. But I want you to think of these potential spaces not as spaces that are enclosed both ways. So it's more of like a highway. So that infection can spread from your chin area and into your neck, further obstructing your airway. And eventually, the infection can get into your mediastinum. The mediastinum is the space in between your lungs, where your heart and the major blood vessels are. So when that infection gets to the mediastinum, at that point it's called mediastinitis, and that now is an even worse emergency. So what I've described is what we call Ludwig's angina, and it's as a direct result of an infection, especially of your lower molars, that is the back teeth on your lower jaw. But all this can be prevented if you seek treatment early.